The approach is to give you a kind of background to what systematic reviews are, how they feed into other dimensions of the guideline development process. So what I did was take a slide out of the manual that NCEC has developed for the production of guidelines. And the three segments that we're going to be looking at are covered not exactly in the same breakdown, but after you've developed the key questions, searched for the guidelines, other guidelines for research studies, the things you were looking at this morning, then the parts that I'll be looking at are going through screening various guidelines, other research studies, and starting to develop into looking at what exactly you're going to be using and what sort of sense of reliability you're going to put on each of those sections. Appraising, I'm going to focus in on appraising of systematic reviews themselves, looking at the strengths and weaknesses in them, and then a little bit about appraising other research studies, or that will tie into what's called the levels of evidence, looking at the different types of studies and the different types of information that they provide and how you kind of rank the strengths and weaknesses of each of those. So those are the sections of the manual that we'll be looking at this afternoon. So a systematic review itself, this is the definition from the Cochrane handbook. I'll talk about Cochrane in a second. But a systematic review attempts to collate all the empirical evidence that fits pre-specified eligibility criteria in order to answer a specific research question. It uses explicit systematic methods that are selected with a view to minimize bias, thus providing more reliable findings from which conclusions can be drawn and decisions made. So some of the key aspects here is that well, I guess first of all, it is an attempt. There's an acknowledgement that this is not going to be the answer to everything that you'd like to know about a particular topic, but we're trying our best to come up with all of the evidence that fits in with your criteria. So there is an effort to be as comprehensive as possible. And so this is to overcome one of the weaknesses that often we'll come up with a general review and people saying, well, how come you didn't talk about this study over here, or you seem to have not addressed this part of this topic. And a systematic review tries to capture everything and then comment on everything so that people will know right up front why you have or haven't addressed things that they may have thought were central to your topic. Obviously, it's systematic. It takes a very kind of stepwise approach to looking at all of the evidence. There are eligibility criteria, so you set out ahead of time. This is where really thinking carefully about the topic that you're looking at or the question that you're formulating. What is it ultimately you want to provide? That should impact on the question that you approach the search for the literature with. And so you decide ahead of time. For example, this could be that you're focused on only children, or you're focused only on older adults, or you're focused on everybody and you want to address every possible population. Those are the things that should be set out ahead of time for a good systematic review. And then uses explicit systematic methods, which we'll be looking at as we go through the afternoon. And the effort is all focused on trying to minimize bias. There's an acknowledgement that bias creeps in almost everywhere when you try to do any sort of research, or even when you try to develop guidelines. When a systematic reviewer starts off into reviewing the literature, the chances are they're doing it because they have a really good sense that this thing I'm reviewing is, either It's just not effective, it doesn't work, and yet we're being told we need to use it, and they want to find the evidence to support that. Or maybe they realize there's this new thing out there that in Australia they're using it everywhere and we're not using it. Why is that the case? There's going to be some pre-existing reason that's motivating people to really look at this area. And the problem is that those pre-existing ideas and beliefs can sometimes introduce bias if you're not careful to put steps into the process to counteract those tendencies that we all have to find the answers we'd like to find, as opposed to finding the answers that really the evidence is actually able to support. So this is the definition from the Cochrane handbook, and this is a handbook for those who are doing systematic reviews. So you may or may not actually need to use this, but there is basically as much detail about doing a systematic review in this handbook as you might ever need. And there's many sections in it that are really helpful to understand, well, why did they do it this way? Or what did they mean by that particular method of doing a systematic review? So if you have detailed questions about systematic reviews, it's a free online textbook that you can access. So Cochrane is an organization, it's an international organization, currently has probably about 30,000 people involved worldwide, the vast majority of whom are not paid by Cochrane to do what they do, that instead it is healthcare practitioners, social care practitioners, statisticians, librarians, people who are really concerned about providing the best evidence for primarily healthcare and social care types of interventions. And they work on developing systematic reviews as part of their research time, maybe part of a protected time if they have got that as, say, within a PhD or within a research project. But the majority of them are doing this on their own time. And the organization is called after Archie Cochrane, who was a doctor who qualified just before World War II and joined the British military corps and was sent overseas. And on his very first mission, he got captured by the Germans and spent the whole war in a prisoner of war camp. And it was there that he got his love of evidence and of research, because as he was trying to keep his fellow prisoners alive, he had almost no resources other than taking notes on whatever it was he had available to try to give the men. So he kept detailed records of if they, had so many calories that they were able to take care of them. If they did get a Red Cross package, what actually was working. And it was out of that he developed his love of recording data and trying to summarize the evidence to guide him in the future. He at first was kind of doing whatever he could, and then realized a systematic approach to all of this is really necessary. And after the war, he realized that this systematic approach really wasn't being followed in much of the medical practice that he was exposed to. And he wrote a small book in '72 that got a lot of attention at the time, and in it he kind of made one of his well-known statements that it's a great criticism of our profession, the medical profession, that we've not organized a critical summary by specialty or subspecialty, adapted periodically, of all relevant randomized controlled trials. And so he started to call within the NHS for someone to be systematically reviewing the evidence on the various things. And so it was actually a pregnancy and childbirth group at Oxford University that first took up the challenge of doing this, and they realized there had been research done all over the world on pregnancy and childbirth, because it's a worldwide phenomenon. And nobody had tried to bring it all together and figure out, do we need more research on this topic, or is there actually evidence all over the place that if we just brought it together, it would show us that there is a convincing reason to do this or to not do that. And so it was the group at Oxford, inspired by Cochrane, that went on to form an organization. They produced this summary of the evidence in 1992, and the response was so great that people said, you need to form an organization to start doing this in all sorts of other areas. And that's when Cochrane in '93 as an organization was formed. So it has remained an international organization, non-profit, it's independent. It only takes funds from national healthcare systems or other donors. It will not take funds from anybody with a commercial interest in anything that they're reviewing. And its aim is to promote and maintain accessibility to systematic reviews, specifically of healthcare interventions. So it has a relatively narrow focus on the interventions that are of relevant to healthcare and social care as well. While it produces systematic reviews, it acknowledges that systematic reviews are not going to be a guide clinical practice. And so while Cochrane is sometimes critiqued as saying, well, you know, you think that if you have a systematic review, you have all the answers and that's all we need. The process of guideline development is based on the fact that systematic reviews aren't enough. There are other very crucial components that feed into either developing really good policies or to making individual decisions around patient care. And so the idea is with this graph or a chart is that clinical expertise is built upon three different aspects. There's research evidence that systematic reviews contribute to. There's clinical state and circumstances, the individual organization or the individual patient or the culture of a healthcare system are relevant to, for example, just what is practically feasible within a particular setting or what is possible, what are the unique aspects of a patient's condition. And then there's the other component that patients' preferences are also needed that have to be taken into account. So Archie Cochrane himself is a shining example of the fact that evidence is not enough to guide people's health behavior. Most of his early work was focused on TB. That was the big illness in the prisoner of war camps. And he maintained an interest on lung diseases. Worked on developing lots of research and lots of reviews in that whole area, and yet he himself remained almost a chain smoker up to the end of his life. So in spite of everything he knew about how to maintain good, healthy lungs, he went off and smoked regularly. And that's a part that has to be taken into account even with the evidence. So how can the evidence be presented so that it can be persuasive, or how can it guide people in order to adopt better interventions or clearer policies? So why systematic reviews then? There's a few basic reasons. One is the information explosion. There's been an estimate that there's about 2 million articles coming out every year. One article I did, it was a gerontologist decided he was going to see what would it take, how long would it take for him if he was to read all the articles in the top 10 journals in his field. And he reckoned it was going to take about 360 days of the year if he was to just keep up with the literature. So nobody is able to read everything in their own field. And so there are these trends that are going on. There's increasing numbers of trials being done and publishing research results. There's a huge increase in case reports, reporting on what happened with individual patients. And so there are all sorts of reviews being published, tens of thousands of them. But this is where systematic reviews are coming up. And you can see it's a relatively small number at this point, and it's in contrast with these other reviews that we're going to talk about in a moment. because everything that is labeled a review is not a systematic review, and it's important to keep the distinctions in mind. But one of the issues is there's so much information, we have to summarize it in some particular approach. There's an issue with reproducibility. For example, there was a review published a couple of years ago of 53 landmark studies in hematology and oncology. These were studies that at the time when they were released, they were reported as being breakthrough, that this was going to really make a huge difference in care of hematology and oncology. Of those 53 studies, how many do you think were later confirmed as actually contributing majorly to clinical care? 3? A little bit more pessimistic. There's 6 of them. So 11%. This review of this research also actually interviewed the researchers, and these were not fraudulent people. These were people not trying to pull anything over on people, but they were competent, well-meaning researchers. But the way the early results often came out, it was kind of like, this is fantastic. This is the answer we've been waiting for. And yet, when studies are done again and again, and they find that that really those are often not supported, and this leads sometimes to a problematic view that, well, it's just, you just spin the wheel. You know, whatever the latest results of some study are, it's just a random result. Today, for example, coffee is being shown to cause depression in twins. Tomorrow it cures hypertension in teenagers or whatever it is. And this is the problem with part of the reality that research does change and vary, and yet that has to be taken into account, not to lead to us giving up on research and saying, well, it's just a roll of the dice, but instead to review this in a way that we can understand exactly what's going on. So there are different types of reviews, as I've mentioned. There's the systematic reviews that we're going to be talking about. There's a meta-analysis, and this is a subset of a systematic review. So this is a very specific way of statistically combining studies that are very similar to one another. And so it's something that can't often be done, because if you've got an area where the studies are all somewhat dissimilar, it wouldn't be appropriate to try to combine all those results together. In areas of qualitative research, there are what are called syntheses, where people will look at ways to learn from a group of qualitative research that has been done on the same topic. And then there's traditional literature reviews. And I want to point out, these are the reviews that were going way off the chart that I showed you a few minutes ago as being really popular. And a lot of times this is where a journal will approach an expert and say, will you give us a review on the drugs for, hypertension or something like that? And that's what happens. They can often be produced relatively quickly. They often read very well. But there are some weaknesses which then systematic reviews try to address. It may not be clear how the search was done. Why did they pick these 10 studies as the favorite ones? It could be because they just were their favorite ones that they happen to have close by. It may not be clear why those were included and others left out, whether or not they evaluated the strengths and weaknesses of those studies. And it's easier when you don't tell somebody openly how you made all of your decisions. It's easier to find that some bias may have crept in. So what systematic reviews then will do, and we'll come back and look at each of these in a little more detail later on, is to clearly state exactly what the eligibility are for the studies. As I mentioned, is it about interventions for teenagers, or is it for nursing home residents? Is it for people with a certain diagnosis? All of those things should be described early on. The methodology, like with really any good research study, should be described explicitly in a way that somebody else could actually repeat this if they wanted to. They should identify all of the studies. And this is where if you look for all the studies, then you're better able to evaluate, well, which of them actually are relevant to my question, or which of them are of poorer methodological quality, so that we can say, it's not that we didn't find it, we found it, we evaluated it as not being of enough quality to influence our decisions, but that is actually talked about. The studies themselves should be evaluated for their quality, or what's called risk of bias. And this is the topic that we'll do in the later section of critically appraising studies. And then the presentation should be systematic. It should be based on what actually was found in the systematic review, and should explain what the key characteristics were. If a meta-analysis is done, it should be justified, showing that the studies were legitimately similar enough to put into a meta-analysis. And if not, then you will more than likely end up with a narrative summary of the studies. Much like a general sort of traditional review, but what's different is that you get to see all of the methods that were used to come to the point of then, in a narrative, discussing these were the studies that were found, these were their conclusions, this is what we think should impact the clinical practice or the guidelines or the individual patient decisions. Okay, so that takes us through our first sort of introduction to just what a systematic review is.